How to keep your heart healthy after surgery. The irregular heartbeat of atrial fibrillation is a possible complication after surgery. If you're about to have surgery, anxiety could momentarily give you butterflies and make you feel as though your heart is racing. But the actual surgery can leave some people with a rapid pulse and heart fluttering, known as postoperative atrial fibrillation, or AFib. Most of the time, atrial fibrillation after surgery lasts just a short time, hours to days, says Shepal Doshi, MD, Director of Cardiac Electrophysiology at Providence St. John's Health Center and a cardiac electrophysiologist at the Pacific Heart Institute in Santa Monica, California. But once you experience atrial fibrillation, you're at an increased risk for having it again. It's more likely to become a chronic condition within 5 years of your first episode, Dr. Doshi says. Surgery can trigger this condition because of the stress it places on the body. Any kind of stress to your system can cause atrial fibrillation, says Smit Vasewala, MD, Assistant Professor of Cardiology at Loyola University Medical Center's Stritch School of Medicine in Maywood, and an electrophysiologist at the Center for Heart and Vascular Medicine at Loyola Gottlieb Memorial Hospital in Melrose Park, both in Illinois. Some types of surgery, notably heart surgeries, are more likely to cause AFib than others, especially open heart surgery, Dr. Vasewala says. Atrial fibrillation occurs in from 5 to 40% of people who undergo coronary artery bypass graft surgery, according to a study published in 2012 in the Avisna Journal of Medicine. Another study of 229 people who had coronary artery bypass surgery found that nearly 25% experienced an episode of atrial fibrillation afterward. Those findings were published in September 2014 in the journal Heart, Lung and Vessels. AFib is common after heart valve replacement surgery, too. It occurred in more than 40% of participants who had aortic valve replacement surgery, according to a study published in April 2014 in the Journal of the American College of Cardiology. Advanced age is another risk factor for atrial fibrillation. About 25% of people over age 85 who have abdominal surgery experience AFib, according to a study published in January 2015 in the World Journal of Surgery. Having chronic obstructive pulmonary disease, COPD, and being obese also increase the risk for post-op AFib, Vasewala says. How to reduce your risk for atrial fibrillation after surgery, because overall heart health plays a role in developing atrial fibrillation after surgery. Doshi wants his patients to be as healthy as possible before surgery. A significant amount of atrial fibrillation treatment is prevention, he says. We may be able to adjust their medications and get them in the best shape prior to surgery. Work with your doctor to plan a healthier diet and improve your physical conditioning with exercise, the American Academy of Orthopedic Surgeons suggests. Here's what else you can do to reduce your risk for atrial fibrillation. Ask your doctor about post-op pain relief. Research suggests that pain may trigger a response that contributes to post-op irregular heartbeats, according to a study published in 2011 in the journal ISRN Cardiology. Ask your doctor about your pre-op blood test results. The same study found that anemia, an iron deficiency, an electrolyte imbalance, and elevated blood sugar levels could be risk factors for post-op atrial fibrillation. Related, a surgeon gets back into rhythm after her atrial fibrillation, taking care of atrial fibrillation after surgery. While in recovery following heart or other surgery, you're likely to be on a heart monitor so that the nursing staff can check you for atrial fibrillation by looking for a heart rate that's over 160 beats per minute, Normal is 60 to 100 beats per minute, according to the American Heart Association. Most people can feel if their heart flutters and their pulse races. But some, exhausted from surgery, may not, Doshi says. That's why patients are closely monitored. Most of the time, post-operative AFib goes away by itself. If not, you may need to take medication to control both heart rate and heart rhythm. Your doctor also may give you a blood thinner to prevent a stroke, which is the biggest concern with AFib. Blood thinners prevent clots that can form and break off, causing a stroke. But depending on the type of surgery you had, your doctor may need to wait, for your safety, before prescribing a blood thinner. The wait can vary from a day to a week or so, Doshi says. Depending on the extent of the AFib, your heart might need to be shocked back into normal rhythm with a procedure known as cardioversion, notes the Heart and Vascular Institute at Johns Hopkins Medicine in Baltimore. AFib awareness results in risk reduction. If you have risk factors for AFib, such as high blood pressure, a heart condition, or hyperthyroidism, and are planning any kind of surgery, discuss it with your doctor. Once home from the hospital, call your doctor right away if you experience atrial fibrillation signs and symptoms. Don't wait for your follow-up appointment. Vascular stresses. Know the symptoms of atrial fibrillation. According to the American Heart Association, symptoms may include quivering, fluttering, or thumping heartbeat, general fatigue or fatigue when exercising fast, irregular heartbeat, dizziness, faintness, and weakness, shortness of breath, anxiety, sweating, chest pain or pressure in the chest,